You went to bed last night feeling completely fine. No chest pain, no dizziness, no warning signs. And yet, while you were asleep, your brain may have been experiencing restricted oxygen flow. This wasn't because of a disease or a medication. It was because of the exact position your head was resting in when you closed your eyes. I need you to hear this carefully, because what I'm about to share has nothing to do with diet, nothing to do with exercise, and your doctor has probably never once brought it up during any of your checkups. My name is DR.Camila. Over the years, I've spent reviewing cardiovascular and neurological research for patients in their 60 seconds, 70 seconds, and beyond. I've seen one silent pattern that almost nobody in mainstream medicine talks about openly. The way you sleep, the angle of your neck, the direction your body faces, the position of your spine is actively influencing how well blood reaches your brain every single night. And here's the part that stops most people cold. Stroke risk peaks in the morning hours, with a 49% increase between 6 a.m. and noon, driven by the morning blood pressure surge. That isn't a coincidence. What happens during the hours before that window, how you sleep, what position you're in, and whether your body is properly recovering directly determines how vulnerable your cardiovascular system is when that surge hits. So, before you dismiss this and say, "I've slept this way my whole life," stay with me. In the next 18 minutes, I'm going to walk you through 6 sleeping mistakes ranked from surprisingly harmful to genuinely dangerous. Then, I'm going to give you 2 evidence-backed positions that could do your brain and heart a real favor tonight. But right now, before we go a second further, do me a quick favor. Drop a comment below and tell me, are you a back sleeper, a side sleeper, or a stomach sleeper? I'll be referencing all 3 throughout this video, and your answer is going to matter very soon. Why things change after 60. Let me give you some context before we get into the list, because understanding the why makes everything else make sense. When you're young, your blood vessels are elastic. They stretch, adapt, and compensate. Even if you sleep in a weird position, your cardiovascular system quietly corrects for it. You wake up with a stiff neck, and that's usually the end of it. But here's what changes after 60. Your arterial walls begin to stiffen. The small vessels feeding your brain become less flexible. The pressure inside your skull becomes more sensitive to body position. Your blood pressure regulation system becomes slower to respond, especially at night. Doctors call this overnight blood pressure dipping. Healthy sleepers experience a natural 10% to 20% drop in blood pressure during sleep. This is protective. It's your body recovering. But if your sleep position is wrong, if it's compressing the wrong vessels, restricting airways, or tilting blood flow in the wrong direction, that natural protective dip gets disrupted. That's the framework for everything that follows. The 6 sleeping mistakes. Mistake #1. Sleeping fully flat. It sounds benign, right? Physiotherapy websites and mattress companies often praise it, but when you lie completely flat, especially after age 60, blood doesn't distribute evenly. In the absence of gravity, cerebrospinal fluid can pool, causing intracranial pressure to edge upward. If you wake up at 3 a.m. with a dull, throbbing headache behind your eyes or at the base of your skull, don't just dismiss it as getting older. That may be your brain's way of saying the pressure is too high. A study in the Journal of Clinical Sleep Medicine found that even a 15 degrees head elevation led to measurable improvements in nighttime blood flow. Mistake #2. Stomach sleeping. The big deal here is your neck. You physically cannot breathe face down, so you rotate your head to one side, usually the same side every night. This puts your neck in a 90 degrees rotation for hours. Running along your cervical spine are the vertebral arteries, which carry blood to your brainstem and cerebellum, the areas responsible for breathing and coordination. Extreme rotation kinks these arteries like a garden hose. Furthermore, your rib cage is pressed against the mattress, meaning every breath is a fight against compression. You never reach your full tidal volume, the deepest, most restorative breath your lungs can take. Mistake #3. Stacking multiple pillows. People do this for acid reflux or snoring, but when you stack 2 or 3 pillows, your head is pushed forward and your chin tilts toward your chest. This cervical flexion compresses the vertebral arteries from the front. It also obstructs the internal jugular vein, which is your brain's primary drainage pathway. When this is blocked, used blood drains less efficiently, and your brain's ability to clear metabolic waste is compromised. You wake up with brain fog, feeling waterlogged, despite getting 8 hours of sleep. The correction? 1 properly contoured memory foam cervical pillow. Mistake #4. Right side sleeping with cardiovascular history. Side sleeping is generally good, but the direction matters. Your heart sits slightly left of center. When you lie on your right side, gravity pulls the heart away from its optimal resting position. More importantly, it compresses the inferior vena cava, the large vein that returns blood from your lower body to your heart. For someone over 60 managing high blood pressure or heart issues, this adds unnecessary nightly resistance. Research in the European Journal of Heart Failure found that heart failure patients instinctively avoid right-side sleeping because their bodies detect the discomfort before their minds do. Mistake #5. The tightly curled fetal position. It feels warm and protected, but 3 things go wrong. Lung compression. Your rib cage can't fully expand, dropping oxygen saturation. Joint compression. Vessels behind the knee, popliteal vessels get bent, reducing circulation. Neck flexion. You experience the same drainage and arterial issues mentioned earlier. A simple fix is a body pillow between your knees to open the hip angle and straighten the spine. Mistake #6. Late eating and alcohol. This is the most common social mistake. After a large meal, blood is rerouted from the brain and heart to the digestive system. In older bodies, this can create transient drops in cerebral blood flow. Add alcohol, which is a vasodilator, and your blood pressure begins to yo-yo as the body tries to stabilize. The American Journal of Hypertension found that even moderate alcohol within 3 hours of sleep disrupts the natural nighttime blood pressure dip. If you wake up at 2 a.m. with a hammering heart, it's often your vascular system struggling to handle these pressure fluctuations. The solutions: what your brain actually wants. Position #hone, left side sleeping. This is the most evidence-supported position for adults over 60. It takes the pressure off the inferior vena cava and aligns with the heart's orientation. Even more importantly, it optimizes the glymphatic system, the brain's janitorial crew. Scientists found that this waste clearance system, which flushes out amyloid beta and tau proteins linked to Alzheimer's, is most efficient when sleeping on the side, specifically the left side due to the brain's drainage geometry. Position #2. Back sleeping with 15 degrees, 30 degrees, elevation. If you cannot tolerate side sleeping, you must elevate your upper body, not just your head, but the entire torso on a gradual incline. This uses gravity to assist blood return, reduces intracranial pressure, and keeps the airway open. Adding a small pillow under your knees creates a zero-gravity posture that minimizes strain on all vessels and joints. Closing and environment. Position is the foundation, but your environment matters too. Temperature. Keep it between 65 degrees Fahrenheit and 68 degrees Fahrenheit to lower nighttime blood pressure. Light. Blue light from screens after 9 p.m. stops the glymphatic system from working. Monitoring. Consider an overnight pulse oximeter. If your oxygen drops below 92%, you need to speak with your doctor. Your risk of stroke doesn't clock out when you fall asleep. Pick one change tonight, just one. Switch to your left side, elevate your head, or stop eating 3 hours before bed. These are not small things. They are consistent interventions that compound over time. Which change are you going to make first? Tell me in the comments. And subscribe right now, because next week I'm covering 5 early morning symptoms that cardiologists say are far more serious than most people realize. Symptoms that appear in the first 20 minutes after you wake up. Until then, sleep smart, protect your brain, and take care of yourself. I'm DR.Camila. I'll see you in